Hello, my name is Michael Mangino. I'm an orthotist from the New York area. We have offices in New York, New Jersey, and throughout the New England and Mid-Atlantic states. I've been an orthotist for 35 years, and I've been practicing scoliosis that long. About 8 years ago, I was introduced to the WCR brace, and we have found it outrageously more effective than anything we had been using at that time. The brace is basically corrective in nature, which is something that I could never say about what all the other prior bracing and most of the TLSO solid braces that are being utilized in the United States. The fact that it is corrective is just something that to be done. It probably can reduce the original curve by as much as 10 degrees if you go beginning to end. And the acceptance from the patients has been really quite good. The brace is lighter and thinner than any brace that's been utilized, and the degrees of which we can modify the brace and keep up with the patient's growth has been an experience that we had not been able to do with previous brace designs. So the patients are quite pleased, especially if we combine our services with short therapy. The combination has been dynamic, something you can see, something we can measure. We can do most of our measuring against the photographic grid, and the patient themselves is encouraged to keep doing and wearing the brace and able to function and do everything they need to do in school and the like. Usually the brace is not worn for sporting events and some of the social events that they'd like to wear, but the utilization of the brace, we use it mostly in our area at 16 hours a day. It does vary with the doctor's preference, obviously. The brace can be worn daytime and nighttime. It's quite effective in the fact that it is a four-dimensional brace, and it's been an effective tool for us to use and keep our patients comfortable. We've had pretty good acceptance utilizing it with the insurance carriers once we're able to document how effective the brace is and that we can avoid surgery to a point a lot greater than what we were doing with conventional TLSO style bracings like the Boston, Charleston, Providence, and the like. Wilmington braces. We've our experience in all of them. That's the mainstay of what we used to do. But now virtually all our patients are coming to us, and most of our doctors are now prescribing Rego braces. We call them WCRs for simplicity's sake, but it's an effective brace. And I highly recommend if you're a family member looking into and finding out that your child has got scoliosis and they want to know what the best way to go is, I think you'll find that if you talk to a WCR orthotist anywhere, they'll be able to explain the situation to you and how the brace is effective and what can be done to help the situation and try to do more than just retard the curve. Now the fact is you can actively try to reduce the curve.